Good morning, good afternoon to all of you. This is Joanna Perry from Exxat. Thank you for joining us today for this Sites and Locations webinar. Helping me today on this webinar are a few of my colleagues. Sai Krishna will be presenting, and then we also have Skylar and Kanthi to help me with answering your questions throughout the presentation. A few housekeeping announcements before we get started. This webinar is recorded, and you will receive a copy of the recording sent to your email within a day after completion of the webinar. You will also be able to find the webinar recording on our Exxat Vimeo channel. You can find today's handout of today's presentation attached in the GoToWebinar control panel, and feel free to follow along as we go through the presentation today. Please use the question section to ask questions or comment throughout the presentation, and we will be manning those questions and addressing them during our question breaks that are baked into this presentation. If you are having any technical difficulties, please use the chat box and we will help you out. Take it away, Sai.
Thank you for the quick introduction, Joanna. Before we get started, I would like to take a moment and walk the team through the agenda of today's meeting. So we will be covering overview of what is sites and location, how do we add sites, how the contracts and affiliations are being added, how do we manage locations within the system, if we are planning to see those locations on a map view, how we can view the explore locations, and also if you're planning to capture availability from sites, which are slots. I'll be walking through the team in detail, and also we have some new reports which I would like to share with the team, and also how we can share resources with the clinical site partners over with the sites. And also we have abundant resource material which we have housed in our health center. I'll be sharing that in detail with the team. So without further ado, let's get started. So first, I would like to walk you through the overview of sites and location. So site where the business takes place, where you can build your contract, and location where the patient care takes place. So site group is who owns the location, and the location is specific address where the students are placed. So what address is required for the students to show up at the right place for their placements? So site where the business or you built your contract, location where you send your students for their clinical experience or for to complete their learning activities. In Exxat Prism, we do offer discipline-specific labels for sites and location to better reflect the structure and the terminology used in different healthcare disciplines. For example, in nursing program, we have sites, which is basically the hospital, the overarching organization over a business. Location is the unit where the specific area where the students are complete their clinical rotation. For example, it can be a ICU unit, it can be ER. If we talk about PT, OT, or PA, the sites are basically the health system, the larger healthcare network, and the location can be the hospital or clinic. There are some cases where you might have the standalone clinic where you send your students for their clinical experience. So you can add them as site as well as location. Also, for example, for teacher education, the sites are basically the school districts and the locations are the actual school. So based on the discipline, we can change the terminology within the system. For example, in social work, the sites are agencies and the locations are actual locations where the student goes. So let's see how we add sites within the system. So when you log in into your Exact account, on the left hand side, you will have a hamburger button. When you click on that, a drawer will open where you will click on sites. The by default landing page is location. But for today's presentation, I would like to start with setup section. And within that setup, we can establish the basic configuration and options that you might need while you're adding your sites or locations. So for the first option within the setup, you will see is announcement. So announcement is used when you need to share some important messages with your clinical site partners. And announcements can also include some important updates regarding your course syllabi, your student guidelines, any changes in course policies, or any documents, or any notification which you would like to notify to your site partners. So in order to add, you will be just clicking on the button and filling out the mandatory details. And on the site resources page, the announcement will show up on messages from school. And also, if the message is little bit large, then the user needs to just click on show more, which will show the entire message. All right. So I will be walking you through the site resources page towards the end of the session, how we can share the site resources page with our clinicals affiliated site partners. And moving to the next, which is resources within the setup. So the site resource feature facilitates the communication between site partners by providing a platform to share updates, maybe some important information, functionalities to create, edit, or organize resources, ensuring the relevant details are easily accessible to all your stakeholders. For example, this can be a course syllabus document, an updated course syllabus document, right? Or student onboarding document, or a reading material, and most updated magazine on your end. Or if you're highlighting any site partners on your magazine, you can also share that magazine with within the site resources page and share it with them. So in order to create that, you can create your own custom categories like any student handbooks, preceptor, or clinician documents, right? And the categories can also hold information like document, links, videos, or frequently asked questions can be created. So those site resources will show up on the site resources page where they can apply filter on documents, videos, links, or frequently asked questions. And also you can create site organization. The site organization is a tool which enables institution to create and manage, curate the categories for sites, locations, and personnel. This will help in better organizing and tracking important detail across various sites and location of the personnel. For example, if we talk about sites and location category, right? If you have any standalone clinic, or if the location is in rural, or if it's a private practice, if the location in rural and it is providing a payment to the students, then you can create those categories and tag it to your sites. For example, few years down the line, if you want to know how many sites do you hold which provides a payment, so that you can pick the students who requires a payment. Or if you want to know how many sites do you hold which offers a capstone project or a project for the students, so you can create a category called project and you can tag it to your sites. Likewise, if you click on that pencil icon, you can create that category and save it. Likewise, under personal category, to track the personal based on their roles, such as this assisting on the capstone project, or they are supporting to the other programs, or their specialization with a particular practice specialty, you can create those categories by clicking on the pencil icon and save it, so that you can tag it to your personnel. If you need to know, for example, if a particular clinician is working on a specialty, and if you want to know how many clinicians do you hold who is performing on that specialty, you can just apply filter on that specialty category under personal category, so that you can see all the personals on your end. So you can add that personal category and save it, so that you can tag it to your sites. Likewise, you also have location category, classifies the location based on the regions like East Coast or Gulf Coast or Arctic Coast or Lake States, right? Or if you are, the by default values which you see is in area, out area, or out of state area. So if you're planning to place your students out of state, when you apply this filter, you will have list of all the sites which are falling under out of state. All right, moving ahead. So you can just add the location area and save that information. Moving it to the contract organization, the contract status or the contract organization will help you categorize your contracts. For example, if you have any open-ended contract which needs to be grouped, like for example, open-ended contract review in 3 years, or if the addendum needs to be updated every 5 or 10 years, right? You can create those categories. Routing checklist. So if you have any particular routing checklist which needs to go through, like a department sign off, or a copy sent to the department, or certificate of insurance, you can create those categories. So managing contract status provide flexibility in managing across multiple programs or single program. So if you're managing across multiple programs, for example, if your contracts are shared, then the status is managed at an institutional level and it is accessible to all programs. If it is not shared contract, then each program can manage its contract status independently. If it's a single program, then they can add or manage their contract status individually by each program. Note that this is a newly released feature, contract status, where you can add. So you can add all contract statuses like in development, in negotiation, right? All those new categories which you would like to have. Moving ahead, the contract site sharing model. In Prism, we allow institutions to create and manage a single centralized entry for all common sites, locations, and contracts, which can be shared across all the programs or within the in your institution. So when you share the site details, right, you can view the sites, locations, contracts added by your institutional admin or any other program within your institution. They can view yours as well. Depending on the role-based access, you have ability to claim sites along with their associated locations and contracts that were added by another program or institutional level admin. By associating your program with these records, you can gain, add, edit, or delete access based on your role. Any update or modification made on shared information will be visible to all programs, ensuring that consistency and accuracy across the institution. So now you may choose not to share details. So each program will be able to maintain its own independent set of data. Information added by one program will not be visible to another program, maintaining program specific record. For example, as per this grid, I have this non-sharing model. If your institution or if your program opts for non-sharing model, and if you need to know on which model is your program on, so when you log in into your exact account, under setup, you have this tab which says site sharing model. So where you can see whether the information is being shared across program, whether it is not being shared. If it is being shared across program, on the grid, you will be able to see all the details which are being shared. So let's take a pause here and have a quick question for our poll. Thank you for taking time to respond to the poll question. It was wonderful to see that many of you are using actively this feature. But for those who are not actively using this feature, I would be happy to share how it simplifies your process with site contracts. With Prism, you can enjoy hassle-free placement process by making access to the most updated site information along with the respective contracts, making it easier to place students at a location with confidence. So let me walk you through how you can set up auto notification within the system. So when you log in under setup, you have auto notification. When you add an auto notification for expiring contracts, you can select the counter in number, whether you would like to receive for 1 day, for 30 days, the contracts which are expiring in 30 days, or contracts which are expiring in maybe 10 weeks or maybe 30 weeks, or if the contracts are expiring in 1 month, you can select those frequency. And also you can set the frequency of emails which you can receive: daily emails, weekly, monthly, or yearly. And the emails will be rolled out at morning 9 a.m. Eastern Standard. And also you will be able to select the recipients who should be receiving those expiring contract details. So this will streamline your process to make sure that all your contracts are up to date so that you can have a hassle-free placements. During the placements, it will become easy for you because you will have a most updated contracts with you. All right. So let me show you some sample notification of contracts. So you will be receiving an email of the contracts which are expiring in a certain duration. So moving ahead, under setup, we also can configure site assessment. So regularly evaluating your clinical sites is essential. Delivering high quality experiential education or custom site assessment forms can make this process more efficient. So you might have this question: why to use site assessment form? This form empowers schools to gather details, feedback on their clinical sites. Their insights to collect can be used to assess the site performance, enhance experiential education, plan future placements, and support your accreditation efforts. You might see the key benefits are in customizing your questions tailored to your form or to gather information specific to your program requirements and accreditation standards. It can be easy access to insight, leverage the comprehensive report to analyze the responses, identify the trends, and implement the improve improvement effectively. So let me show you a sample how we can add an assessment form. You can create your own custom assessment form. You can customize the details. You can customize the suggestions. And once the form has been made, you can save it as draft. You can review it. You can also publish it. And once it is published, you will be able to see the custom site assessment form which you have created within the system. Let's move ahead and adding a site within the system. A site is a best described a group or an entity which can contemplate relationship in establishing, right? Just as a contract, you may cover one or many physical location. A site may include one or many physical locations. So in order to add site, after setup, you will click on the site tab. On the right hand side, you will have add site where you will fill out all the mandatory fields. Let's assume that if it's a standalone clinic, where the same site where you have built your contracts, and that is the same site where you will be sending your students for the clinicals, then you will be selecting, do you want to add the site as a location? Okay. Next is the location tab on the top. So once you have added all your locations where the students will be completing their clinicals, you will be able to see all the locations which are added into the system and associated with their umbrella corporation. And also you can extract that information into a spreadsheet format. You can reorganize the columns. You can customize the grid, and also you can apply filter on the options. For example, if you need to know the locations which includes maybe a payment, or in location which offers a particular practice specialty, you can apply filter on practice setting. If the location is applicable to other programs, you can pick and see for which program it is applicable to. Next is personnel. So this is a new feature team which will allow you to associate your personnel on an individual profile level. You can also associate your personnel at a site level, and the same personnel or the personnels can be associated at a location level. If we consider the personnel is being mapped at a as a profile, you can just add a personnel. The drawer will show up where you can add all the necessary details. For example, if you don't hold the personnel working on a location, right? And if you know that the personal first name, last name, and email address, you can just add that personal within the system. And later you can associate that personal to a site. You can associate the personal to a location, or you can even associate that personal to multiple locations or sites. So I'll be walking you through the steps. So when you're adding a personnel, the communication preference is important. So if you're planning to acquire availability from the personnel, then you need to make sure that the personnel is included in slots. It includes the personnel for updated information, or if you need some slot confirmation or slot cancellation from that particular personnel, or if the personnel is interested in students, or if you need to send email notification to that personnel to notify about the student placement. So you need to select the communication preferences. And when you click on next, you can also associate the personnel at that very moment. If you're aware, you can select the site. If the personnel is working at a particular location, you can either choose the location, or you can, if the personnel is working at all the locations, then you can select the second option. Let's assume that the personnel is working at a particular location. So you will pick on choose location, where you can associate the same personnel on the locations where the personnel is working. Once you have selected, you will be clicking on done, then the personnel gets associated. Or you can also select all the locations where the personnel is working and save it. Next is personnel tab on the top, where you can apply filter on the wrench icon to slice and dice the information to edit the columns and create a custom report for the personnel. You can even trash out if the column is not required. You can reorder the column if you can drag and drop those 6 dots, and also you can rearrange those columns. Filter icon will allow you to slice and dice the information so that you can narrow down. For example, the personal category. If the personnel is helping on a capstone project, you can apply filter on that custom category which we saw on their setup page. If the personnel is working on a particular practice specialty, and if you're looking for a personnel who is on a particular practice specialty, you can apply filter on practice setting. If the personnel is on a particular designation and if you not need to list down certain designations, you can pull a report on that. So contracts. Contract section, you can view the sites which are active contracts where you can rearrange the columns, and you can filter the option to narrow down the information, and also you can pull a report based on the expiration, like if the contracts are expiring within 30 days, 60 days, or 90 days. So if you have not yet activated the auto notification and if you're manually pulling, this might be a helpful section, but it is recommended to try out the auto notification feature to keep your contracts up to date before the placements. And also you can pull information contracts, which sites which are missing contracts, and you can extract that information into a spreadsheet format. You can edit the column based on your grid, and also you can narrow down the information as well. Also, we can establish an email communication with your clinical site partners to capture the availability of the site or to capture the updated location information, which I'll walk you through in detail a few minutes down the line. So you have to just set up a new communication by clicking on add or set up new communication, and explore location if you want to review your site information on map or to get a better understanding of what your student sees when researching a site. Like an explore location selection is a perfect tool. Reports will help you to extract all the site specific information, location specific, any personal specific details, right? Any location assessments or any communication intervention or communication reports. I'll walk you through some sample reports. Before we go there, let's see how we can add a site and site profile. Let's assume that you have added a site within the system and you have to just click on that site name. So you will see the site details on the top. The first section you will see is about where you have added that particular site within the system. You can re-edit the configuration which is already added. You can view the programs for which it has been associated. You can also add the requirements of the site. For example, if the site carries certain requirements like a physical exam or a MMR or a background check is a mandatory, you can set up some requirements. So when a student gets placed and when the actual rotation starts, student can make sure that they complete those requirements. You do have certain documents where you want your students to sign it off, right? Those documents can fall under student requirement under upload, where you can upload a sample document. For example, a site checklist or site onboarding document where they have to go through and read through the document and sign it off. So when they click on the plus icon, the drawer will show where you can add your requirement, and if you turn on the bit enable show it to the student, it will show up, and the requirement which are added on the student requirement upload, it will also show up on the location level. So the documents will get inherited on the location level as well. So next is settings. So I would recommend to associate settings which are applicable to the site. So this will help you narrow down while you are filtering information based on settings. For example, if you need to know how many sites do you hold for a particular practice specialty, if you apply that setting, you will see the list of sites on your end. If you want to place a student on a particular practice specialty, and this will come in drop down to see all the sites which you are holding. So you can click on the pencil icon to add all the settings, and all the settings which are added at a site level will get also associated at a location level. The categories, if it's a major medical center or if it's a if it's offering a capstone project to the students, if it's offering a payment, if it's a standalone clinic or a physical or a private practice, you can tag it to that particular category so that when you apply filter on those categories, you will get some results. Also, you can house some generic documents like a reading material. So if a student is placed on a clinical location and they have to go through certain reading materials, you can upload it where you don't require a sign off. You can upload those documents. And if you have any archived information, you can also add that. And also you can share notes with students, or it can be used for your internal reporting purposes. So if you add notes which are shared with students, needs to be added under in notes shared with students, then those notes will be also carry forwarded to the location level as well. So you have to click on the plus icon to add those notes within the system. So let's take a question break here to see if we have any questions in the chat. And please feel free to unmute or let me know any questions.
One question that just came in is just if there's a way to look for all of your sites that do not have a setting assigned to them.
Yes. Yes, you can apply filter on setting. So just give me a second. You can pull a report with the details which are not assigned to a setting. So
So
you
I'll
have
clarify.
a, yeah,
On
sorry,
screen, the
please go ahead.
filter does not have an option for none selected for that setting, but you are able to pull that report of all of your sites or locations to be able to check to see which ones do not have a setting added. It is recommended to add the settings at the location level because if you add the settings at the site level, it automatically passes those settings down to every location under that site. Whereas unless you have like an urgent care group where every single location underneath will all be urgent care, typically it's the larger healthcare group, and then the settings are different in each location. But whichever way that you are adding them, you can run that report. And then if you would like us to help update those in bulk, you can add the correct settings to the spreadsheet and submit it as a support ticket, and we can help complete that for you.
Yes, please.
There are some additional questions as far as paperwork to specific locations or just the entire site. Yes, you can add them at the location specifically. You would just go into the location and add the documents there. If you add them at the site level, it passes down to all the locations, but there is that toggle at the location if you need to say that the site paperwork doesn't apply to this specific location. Um, and the syllabus section of the resource page, um, if you're not able to have the syllabus show up after having followed those instructions, then please submit a support ticket to our prism-support@exat.com, and we can help you further just to troubleshoot that for you. All right, you can continue.
Thank you, Joanna. Thank you, team. So moving ahead with contracts, Prism helps you efficiently capture, manage essential contract information and documents for each site. This walkthrough will guide you through the steps to add, link, manage, unlink, and even delete contracts within the system. Additionally, please remember we do have auto notification feature for expiring documents is now available to ensure you stay up to date with your contract effortlessly. So under a particular site, if you go under contracts, you will see a plus icon where you will be able to add all the contract specific details. If it's an open-ended contract, you have to check off the box. It will gray out the end date of that contract, and you will be able to add the contract template if it's an active contract, current status of the contract. And please remember the contract status is a new feature which where you can have a new custom values which is under setup now, so that you can select your own custom values. And also you have, if you have any reference address which you are having or holding, you can add that information and save it. So once the contract is added, you can also add your primary point of contact under contact details with whom you are working. So if first you will see only one contact, but if you have more than one contact person at that site, you can also add more contacts by clicking on add contact person and save it, so that you can pull this information and report and reach out to them later while renewing that contract. And also you can see the contracts which are applicable to other programs. You can select them, or if it is not applicable, you can deselect them. So this particular section will show up if your program or institution is sharing the location across programs. Otherwise you will see this section will pencil will gray out, and you will see this list will be blank. Any category which you would like to assign to the category. For example, if this particular location is requires annual addendum, or if this location contract will expire within 1 year. So if the location contract is applicable to certain practice specialty students, right, you can assign those categories. You can also have locations contract for the location which is being covered. You can select all those locations and save it. Any routing checklist for this particular contract, you can add those details. If it needs to go through the dean, if it needs to go through the department or pro visit, you can add all those details and save it. Also, contract document, the physically signed off affiliation document which you have, you can also upload it. And if you're planning to archive this document within the system, then you have to check that box if it is an old. If it's a document which needs to be shared with the student, then check off share it with the students. If it's a confidential document which should not be shared with any students, you have to make sure that those check boxes are kept blank, and you have to just upload the document. Currently, the uh, upload functionality has been increased from 10 MB to 25, so you can now upload larger documents as well. Also, you can link the contracts to the multiple sites. So you have to search the contract name where you can select that particular contract and click on save. Also, you can generate the contracts. For example, if you want to generate a contract and if you don't see a contract template at the university or your specific template, you can generate a Prism support ticket to have that template added here. Once you add all the contract specific information during your renewal, if you want to generate the document, you have to select the document and click on generate, which will cut down your time manually typing that contract specific details in your document. So you can directly generate and share it with the site to have or initiate the conversation on renewal process. Moving to the location, within a particular site, under locations, if that particular site is a private practice or a standalone clinic, you will see one location. But by any chance, if that particular site acquires more locations or more addresses where the students can go and complete their learning activity, you can also manually add or associate the location. So when you add the locations, you will need to fill out all the mandatory details so that you can add the new location within the system. So once the location is added, and when you click on that location name, the first section on the left hand side you will see is about, where you can re-edit the basic information of the location, where you can see the contract specific details such as the contract name, contract status, if the contract has a start date and end date. If you observe the contract specific document, the contract specific point of contact is not carry forwarded. Also, the practice specialties which are added at a location level is now inherited at a site level. But by any chance, if you say that, Sai, you know what, the particular practice specialty is not applicable to this location, then you can also manually edit it by clicking on that pencil icon and remove the settings or the practice specialties which are inherited from the site, and just select the settings which are applicable to this location. And also you can add categories to this particular location if this location has a unique category. For example, this particular location requires an interview before the student goes, so you can create a category interview required and you can tag this category to this location. If it's a major medical center or if it's a private practice, you can also tag them. And also, if the requirements are for this locations are unique, all the requirements which are added at a site level will get inherited to the location level. And if this location has a unique requirement, if the location which inheriting the requirements is not applicable, you can also edit and remove them and associate the requirements which are applicable to this location. Also, the documents which you need to collect, the placement clearance document before the student gets placed, so you can also upload them. All the documents which are inherited from the site, you will see them, and you have a button which says enable for this location. If you turn it off, you can manually add the location specific requirements if you don't want the documents which are inherited to show up on the location. And also you can also see the documents which are added at the location site level will also get inherited, and you can also upload documents which are applicable to the location level as well, and you can also save that information. You can also add housing and parking facility which might come in handy while placing students, or for the students when they get placed on that location, they can see the housing and parking facility. You can also add notes within the system which can be shared with the students or which can be used for the internal purposes as well. So what is inherited? Requirements, settings, categories, documents, student requirements, and notes. What is not inherited? Contract document and contract point of contact details. Let's see how the location associate personal looks like. So once we have completed the about section, you can also map a personal at a location level. So when you click on add personal, on the right hand side you have associate personal. So we have recently added a new button, add personal. This is a new feature. Earlier you were only able to associate. So add personal is will allow you to add a personal at that location level as well. So when you click on that, the drawer will show where you will fill out all the mandatory details. And when you click on the next option, please make sure the communication preference is selected. For example, if the personal needs to be added in slot request for the updated location information to capture the slot confirmation or slot cancellation, or if you need to roll out the placement notification, the communication preferences needs to be selected and saved. And also you can, if the personal already exists on the site, when you do a quick search with that personal name, you will find that if the personal is already existing, you will find that personal in the list. You have to just select and just save it, so you will not require to add that personal from scratch on that location level. So for that particular location, you will see that the personal will get associated to that location. And also you can add communication. For example, during the contract status, or during that contract conversation, or if the student is not attending that particular location, if the student has taken a leave of absence, or if the student was communicated during a midterm or during a final term, any particular communication which was done during with that location, you can add that communication details. You can add mode of communication, you can add follow-up details, you can add what was the document. You can also upload documents which were used during that conversation as well. Also, you can add slots for a particular location. So if you already know the availability of that location manually, for example, if a slot takes 10 students, then you can add those slots manually within the system by clicking on add slots. You just need to associate the clinician, setting, slot status type, and supervision type. If you closely observe, those fields are non-mandatory. So if you're not aware about those fields, you can always keep it blank and you can associate it later. But you have to mention the number of students who will be on that location, which is a mandatory field, and you can save that information. And also you can see the list of students who are placed on that particular location. So this might help come in handy to identify your champion locations. For example, if you need to know how many students are getting placed on a location, this particular tab will help you pull a report on the right hand side, or customize the column, or slice and dice the information within the system, so that you can know how many students are frequently getting placed for which course, for which practice specialty. You will be able to pull a report. Also, if you had any intervention with the site, like personnel is taking unnotified leave of absence, or the student has missed out a session, or if the student was not provided a proper ppe kit, or those interventions can be added at a particular intervention level by clicking on add intervention. You can also have follow-ups, for which you can pull a report and have a follow-up done. You can also do site location level assessments. So even student before gets a placement, if you're doing a site assessment, please note that we now support custom site assessment, which can be built from front end, and it is currently available under setup. If you have created a custom site assessment, or if you want to go with the exact standard site assessment, it is available. When you click on add site assessment to assess your location before the student starts a clinical, or during a placement, or once the placement is done. So when you click on that, you will be able to select the basic information. If it is during a placement, you will be also able to add or tag the student. You will be able to add the placement information. And also at the bottom, you will see the form. If you have created a custom form, you will be able to pick the custom form which is created by your institution. And on the next step, you will be able to see the questions which have been configured, which can be answered. And in the final step, whether you can see whether to continue a relationship, whether to discontinue, or whether you need to intervene for that particular location. So this will help you to maintain a good relationship and to understand how many sites have been recently assessed, how many sites can be utilized for your upcoming placements as well. Location evaluation. If you have certain evaluations which needs to be shown on location level, for example, for PT, if the forms have been published by the institutional admin, you will be able to see them on the location. When you click on view, you will be able to see the responses which were provided by the student for that particular location. Also, we support HRSA grant information. Initially, you will see the blank page on the right hand side when you click on add button. all the options show up where you can add the scores, where you can select the answers in yes and no, so that you can fill up the HRSA grant information and save it. Once the HRSA grant information has been added, it will look something like this, where you can edit the existing information, where you can download the existing information here. Let's see movement or deletion of location. So if you need to move, for example, if the location was mistakenly added or if the location is no longer part of this umbrella corporation, then you can also move the location from A site to B site. So when you click on move location, the system will request you to select the new site where the location needs to be moved. And if you need to delete a location, when you click on delete, a pop-up will show up. If the particular location has dependencies like a placement, like the student got placed or any learning activity is completed or slots have been occupied, the system might not allow you to delete. But if there is no dependency, a pop-up will show up with a number on the left hand side. When you type out that number, the location will get deleted. We also have location movement history. So let's assume that once the location has been moved from location site A to site B, and if you need to know who has done it, when it was done it. So if you go a step back on the locations tab, on the right hand side next to add location, you will see the location movement history. When you click on it, you will be able to see all the details, like from which site to which site the location has been moved, and with who has moved that location and when the location was moved. So let's take a question break and see if we have any questions from in the chat from the users. Joanna?
I've had a few questions just about the landing page to locations and the site to location relationship. So I just want to clarify that again for everyone. Um, the the site is meant to be the overarching ownership group, and in most cases, one site group has multiple locations where students could be placed. If you're a contract sharing university, it might be one site group, but the locations are different for every single domain or program within the university. So you'd have that one site and then different locations for each program. When you do have a smaller clinic where it's the same place they go to for their placement is the same place where you would send the renewal and everybody works out of the same office, then you have those cases where the site and locations are identical, but the relationship as far as having a site or ownership group above the location is mandatory for all of those locations. So you can see how many ownership groups do you have, but then how many patient care or placement locations do you have? And typically it's those patient care locations um, that are shared with accreditation bodies. Um, so if you're looking to make sure that there's no discrepancies, I would check with that location list. Um, for the landing page, it was originally that all of the programs would land on the sites tab when they came into the system, and most of the work was being done at the location level, so it was an extra click for the majority of users. So we swapped that to the location landing page. Contract administrators, we do offer a university level contract administrator view so that you're landing into where you're working on contracts. But for the program specifically, that's the reason why the location is where you land. So I just want to answer those for you.
All right, team. Moving ahead with the site personnel. So when you're at a site, right, we have been through about section. We have seen how our contracts are added, how additional locations are added. Now you can also add or associate a personnel at a location level. Let's assume that you have a new person who is working on a site, right? You will click on add a personnel where you will fill out all the details. First step is to mention all the mandatory details like first name, last name, and email address. Next is the communication preferences. Again, this is a new feature where you can also associate a personnel who is already existing it. So once the personnel has been added at a site, you can also select the site, or if the personnel is working at a multiple locations, or if the personnel is working at a particular individual location within that umbrella corporation, you can select that. And if the personnel has been associated, you will be seeing that personnel on the page. Once the person, if the personnel is newly added, the page gets reloaded and you will see the personal specific profile where you can re-edit the personal specific details, where you can add notes, licensures, certificates, documents, and any assistance. You can also associate the personnel at multiple sites or location. Again, this is a new feature, team. you can associate a personnel at a site or at a multiple locations. On the right hand side, when you click on associate sites, the drawer will show up where you can select the site where you can map the personnel directly, and also you can handpick the new site where you're mapping the personnel, whether the personnel is working on the all the locations or whether the personnel is working on a particular location as well. And you can also disassociate a site, and before you disassociate you have to first make a personal a primary, make mark as a primary, so that the personal can be disassociated from the previous location. Also you can add communication which was took place with that personnel. For example, if the student was absent for a day, if the personnel reached out during a midterm evaluation or a final evaluation, if you want to create a communication within the system, this would be a right option where you can log all the communications which were took place with that particular personnel. Also any interventions, if the student has not performed well during midterm, or if the student has had some challenges on that location, you can add all those personal interventions which the faculty has a one-on-one conversation with that personnel. So you can fill out the details, mandatory details, and save it. And also you can associate personnel if the personnel was already added within the system as a profile but never mapped with a site or a location. You can also click on associate personnel. This is the new feature which will allow you to select the personnels who already exist in the system and just associate them to the particular location, or you can choose the location where the personnel needs to be associated, and you can save it. Moving on to the slots request. So under slots, when if you need to see how many slots were offered for a particular location, how many are available, how many students are placed, you can also add a new slot. This is a new feature team which will allow you to add new slots, edit new slots in bulk, and also delete. So if you click on edit icon, the drawer will show up where you can bulk edit the slots, where you can delete, where you can even add the information. So if you are going to edit the bulk edit, then you can also select the field. For example, the slots are being updated for a new location, or if the personal it needs to be updated for those location, you can also select that and save it. So once the bulk update is done, next tab which you will see is site placements. So all the placements which took place for that particular sites and within that location, you will be able to pull a report so that you can see across all the locations how many placements were done. So you can extract that information, you can edit using the wrench icon, you can narrow down the information by clicking on the funnel icon. You can also have intervention added for at a site level. So you can add intervention at site level, you can add intervention for personnel, you can add communication at a site level, location level, and as well as at a personal level. So when you click on intervention, you can add that intervention, which is also available at student, location, and personal as well. The detail remains same. If you're planning to capture it across multiple locations, you will be able to select the details as well. Site communication, if you had communication across all the locations, if you had communication across one location, you can also log it at a site level. And this communication is also available at student, location, and also at personal level. Site assessments. So you can also assess your sites before the placements, during the placements, or after the placements. And you can also now create custom forms from the front end so that you can uh, capture all your site assessment feedback so that you can maintain a relationship and identify the gaps and pull the good sites for your upcoming placements. So when you click on add site assessment, you will be able to see the custom site assessment form which has been created, and you can be go to the next step where you will be able to fill out all the details and save the information, whether to continue the relationship, whether to intervene, whether to discontinue, to identify the gaps, or to help the student, right? So you can fill out the site assessment, and this might also points during your accreditation visit as well. So how many site visits you might have done, this information will also come in handy during that point. Site communication. So any communication which was done at a site level, the umbrella corporation level, you will be able to capture it, like setting for upcoming sites, clinical evaluation is revamped for that particular site, or any suggestions for the students, right? You can add it. What was the mode of communication? All the details regarding that particular site can be logged, and you can pull a report for location specific interventions and communications as well. Let's see how we can delete a site. Let's assume that there is no dependency of the site, like there are no slots, no placements, no learning activities. You can easily delete. But by any chance, if you have already utilized like adding contracts, adding slots, student placements, or learning activities were completed, then the system will not allow you to delete. You will get a pop-up which will require a help to remove all the dependencies first. So please check for the dependencies. If you need any help, you can always reach out to Prism support to get those dependencies removed as well. So we also have explore location. If you want to review your site information on map, or to get better understanding of what your student sees when searching a site on explore location. So it's a map view where a student can filter or search a site based on the state, right? City, zip code, or based on a location area, based on a setting, based on a particular tag, or even students can draw miles of radius, and the students can reset all the options which they have selected, and students can apply filter, like if they need to know the list of sites which is offering them a capstone project, or if a site which is offering a payment, if a site which is falling under a particular rural area, if the site which is applicable to a certain program, you can select that and apply the filter. So you will start seeing your locations on map view. Moving to the next is slots. If you need to capture availability from the sites, or if you need to capture the updated location information, then you can establish a communication. And also we have guide set up to the communication. You can download the guide and walk through the step. And also you can set up a new communication by clicking on add set up new communication. The first step is to specify the title and select the activities which you would like to perform. Are we planning to capture the availability, or are we planning to capture the updated location information? If it's both, you have to turn on those bits. And the second step is to configure, which will have four sub steps. The first step is to require slots for a particular rotation. You will be able to select your upcoming rotations for which you are trying to capture the availability, and you will be able to add settings, slots, and supervision type. If you're looking for a particular setting, you can click on the drop down and you can pick a particular setting. If it is applicable to all, you will be able to select all the settings, slot types, and supervision types. If the request is if you require any auto notification when the slot confirmation, right, you can turn it on. And also if a clinician says that they would like to reach out to you at a later point, then they will click on contact later. For that, if you need to receive an auto notification, you can turn on that bit, which will trigger an email in your inbox. And also other setup allow site personals to add the slots at a site level. If you turn this bit on, they can easily add slots at a site level. Second step is to request updated location information. So the basic information cannot be edited, but the clinicians will be able to provide notes, requirements, housing and parking facility, any personal details. So please note that they won't be able to actually edit the information which you are holding. They will have a comment box where they will provide a feedback, so that based on that comment, you will be able to go in and make those changes. So you can handpick the information which you would like to show, which you are currently holding, like the current notes, current requirements, current housing and parking information, or personal details. School contacts. If you need to receive slot confirmation, or if you want to share your contact details, so by any chance clinician has a question while providing slots or during slot information, they can reach out to you. And any custom instructions which you would like to set for clinicians. It can be a manual, it can be a step-by-step instruction, or it can be some policies which you would like them to follow. You can add them here. Once the information is set up, you will be able to send emails. So team, this is a new feature where you can see the slots by location as well as personal. So let me take an example. If you need to send slots on a location where you have five clinicians, then you can go by location. So all those five clinicians will receive those slot email where they can review and provide you that information. But if you say that, say, out of those five, I need only two clinicians to provide me those slot information or availability to me, then it's recommended to change your view from location to personal, so that you can handpick the person who should receive that email, and only those clinicians will be able to provide the slot information. For example, if I go by personal, I'll be able to pick the personal who is associated to a particular location, and I'll be able to save the changes and click on next. Let's assume that I'm going to go by personal and I'll click on next. So I'll be able to see two recipients who will receive this email to capture the availability, to capture the updated location information. So I'll just click on compose email, where I will be able to see the total recipients again, where I will be able to see the standard template which is configured. And also you can create customized template as per your program need by clicking on add template. Let's consider if you are going by the standard template, you have to just click on preview. Either you can send this email right now or you can schedule them to go out later. So if you're sending this email right now, the clinicians will receive an email in their inbox, and also you will see a pop-up which will say some emails have been successfully delivered. But if you need to track whether the emails were sent successfully or not, when you click on email dashboard icon, you will be able to see how many emails were successfully delivered, or how many emails were clicked, opened, or whether the emails were failed, right? You will be able to see the status. And also you will be able to resend the link by any chance if a clinician reaches out to you, or if a location reaches out to you saying that the email wasn't delivered, something like that, then you can also resend by clicking on that button. So clinicians will receive the email in their inbox. When they click on that link, they have to just start the slot request, and first step is to provide the availability. So they will click on add availability, and also you can see we are showing the location, sorry, we are also sharing the site level where the clinicians can provide slots at the site level as well. Also on the right hand side, when they click on add availability, the drawer will show up where they can select their name under a clinician. They can provide the setting for which they would like to pick the student, and what will be the slot type, if it requires resume, if it requires interview. And these are non-mandatory options. By any chance, if the clinician selects, you will be able to see them. Otherwise, the clinicians will select their name under the clinician drop down, and the supervision type. The most mandatory field is the number of students. And also clinicians will be able to see when is the clinical experience or rotation start date and end date, and based on that they will be able to save this information. Once the clinician provides their availability and the number of students which they will be able to take, the next step is they will be able to see the point of contact from school, just in case if they have any questions on the right hand side. And also on the next step, they will be able to see all the site specific information which you are holding. But if you closely observe, they won't be able to edit it. On the right hand side, when they click on the pencil icon, they will be able to provide you the comments where they can edit this information and save it. And final step is to review, and once it is reviewed, you will be able to see that the slot information has been provided. And if you need to see the responses, you will just need to click on the responses graph, and you will be able to see how many slots were provided, how many location updated information. For example, for the first location, if the slots were offered, you will be able to see the details, and if any updated information is required, you will be able to click on view details and see what was the feedback provided by that uh, clinician, so that based on that you will be able to update the location information. And if the location information has been manually updated by you, you can also mark it as read, so that you can keep a track of all the updated location information which you have received. And once it has been updated, you will see the status as updated for that particular response. Just taking a question break to check if you have any questions.
I just wanted to mention for this group to make sure that since we are talking about the slot request piece of this as well and updating sites and locations, to call out that there is a webinar coming up on February 19th under Exxat 1. So if you go to our webinars page, there are actually toggles at the top of the screen to go back and forth between Exxat Prism and Exxat 1. And the Exxat 1 webinar will go over how you can link up sites and locations to your information. That is first rolling out for PT programs, and then it will slowly be rolling out to the other programs or other domains also utilizing our system. There's also a webinar for the March 1 mailer steps, which is under the webinar channel page as well. And any of the ones that you've missed are available in recordings under the same page you would register. You can click to see the reporting or the recordings.
Thank you, Joanna. Moving ahead, team, let's explore the reports which we have it on your site. So we have site detail report, which you can extract like the site specific information, which will also include the setting which we are looking for. If you need to know any site which is missed out to be mapped with the setting, or if you need to know the basic details of the site like address, city, state, zip code, fax number, website, if you have any added, you can use the wrench icon to edit the sequence of the column, reorder it, delete the columns which are not required so that you can pull a desired report on your end. And also you can filter out the information based on a particular setting as well. So if the setting has been missed out, you will be able to filter out the information. If the setting has been mapped, this will become easy for you to pull the list of sites for a particular practice specialty as well. Also, we have location specific reports which you can pull on your end. So location details, location reports. When you click on location reports, you can also extract the report by clicking on the wrench icon. Also, we have personal specific report. Let me cover one report, which is personal detail report. So you can download the report by clicking on the page icon. The wrench icon will allow you to edit the column, and the filter icon will allow you to slice and dice the information. And also, team, we have a new report which is comprehensive site assessment report. So if you're planning to create a customized site assessment report or to go with the standardized place, site location assessment, then you can pull a comprehensive assessment report on your end. So when you click on the comprehensive assessment report, you can also include the form data, or if you just need to know the whether the site assessment were done. So when you select the view form data, you can generate a report which will have all those questions. And also we have intervention and communication report which you can extract. This is a new report, team. You can pull that information like any interventions or any communication which you have logged. You will be able to pull a report and find out the status, whether it's open intervention, whether the follow-up is required, whether the follow-up is required in 7 days, or whether the follow-up is beyond 7 days. And the intervention report can be pulled for a location or pulled for a site, and you will be able to see the statuses on the right hand side. In order to take action on those particular intervention, you have to just click on the view on the last column so that you will be able to take action. And you will be able to extract this information into a spreadsheet format and slice and dice the column by clicking on the wrench icon. And also you can narrow down the information by the filter icon. Let me help you go through the site resources with the sites. So you can share the following information with the site resources: welcome message, announcements, course offerings, rotation dates, program, and course specific information. So when you log in into your Exxat account, you have to go under program details, where you will be able to see the first under setup, you will be able to see the site resources page, where you will configure your welcome message, announcements, clinical education schedules, or resources for clinicians, or clinical education contacts. On the right hand side, when you click on view site resources page, you will see a URL. It will open up on a new page. This URL can be embedded to your conversation email template when you're reaching out to a site, so they can bookmark this URL, and the folks who will receive that URL will be able to view this page, where you can house your messages, welcome messages, clinical education, upcoming clinical education schedule, program wide resources, or course specific resources within the system. So you can see the messages. When you click on clinical education schedule, you will be able to see the upcoming clinical education schedule. If you need to share program wide resources like placement details, syllabi, or attendance policy, or onboarding documents, you will be able to see it, right? And they can filter out by based on whether it's a document, video, link, or frequently asked question. And you can also share a course specific resource like course syllabus or reading material which can be applicable to the site, so they can download that information. And also they can reach out to clinical education contact, like if the clinical site partners have any question from the school side, who can be the point of contact can be shared. So when you click on clinical education contact, the site partners will be able to see the names, email addresses, and the notes which have been housed. And I would like to take you through the help resources we have on our help page. So we have abundant resource material for our sites and location. And team, also we have a new feature, artificial intelligence, which will allow you to answer all your questions. We call it as Ask Leo. You can ask any question to Leo regarding sites and locations. It will answer. And also team, we have next in series is courses and rotation. The link is in the presentation. You can click on it and register it for now. And that's all on my end, team. I would genuinely appreciate if you can take a short survey for this webinar, and see you at our next webinar. Thank you.
Very quickly, I just wanted to answer the very last question that came up about the difference between communications and interventions. The communications are really intended for any back and forth dialogue communications with your students. The interventions are when there's a problem. So an intervention is open until it's closed. So think of if your student's under remediation, but a communication is just those interactions. However, both do allow for you to track follow-up to those as well. Okay, and
Sure.
the last question I got about publishing and sending everything to the sites, such as student profiles, I just want to let you know that you can review the placement webinar that would go over that piece of information. You can also look up about sending uh, placement confirmations to sites. That would They are both handled underneath of the placements section of the platform. Publishing is to show the information to your students, whereas sending an email notification would be required for sending anything to your sites and your with your students' profiles. Thank you all for attending. Have a great day.